Welcome to Module 16, Advanced Wound Care Technologies. As healthcare continues to evolve, so does our ability to care for wounds, especially those that are complex, chronic, or resistant to healing. In this module, we'll dive into some of the most promising innovations transforming wound care, from electrical stimulation and oxygen therapy to intelligent dressings and cold plasma applications. Whether you're in acute care, outpatient, long-term care, or home health settings, this knowledge will empower you to deliver next-level, evidence-based wound management. Let's begin. By the end of this module, you will be equipped to describe the core scientific mechanisms behind advanced wound care tools, identify the correct usage criteria and important red flags for each technology, apply safe nursing practices during administration, including patient monitoring and education, collaborate effectively with interdisciplinary teams, including wound specialists and physical therapists, evaluate treatment outcomes, and understand how these technologies can integrate into the patient's healing continuum. Each of these technologies holds a unique place in wound care. Your role as a nurse is not just in application, but also in advocacy and clinical judgment. Chronic wounds, such as pressure injuries, diabetic ulcers, and venous leg ulcers, pose significant challenges. Standard dressings and basic care protocols may fail to stimulate healing in these stubborn cases. That's where advanced wound care technologies come in. These tools are designed not just to protect the wound, but to actively promote healing at the cellular and systemic level. Some of the cutting-edge interventions we'll explore include electrical stimulation, therapy, hyperbaric oxygen therapy, smart all-interactive dressings, ultrasound and cold plasma, negative pressure wound. Therapy later slides. As nurses, understanding how, when, and why to implement these innovations is critical. You are often the first to identify a wound's trajectory, escalate interventions, and educate patients and families on complex care regimens. Let's start with electrical stimulation. Therapy, one of the most well-researched and widely used technologies. Electrical stimulation. Therapy, or EST, involves applying controlled, low-intensity electrical currents to the wound bed using surface electrodes. These electrical pulses mimic the body's natural bioelectric signals that are often impaired in chronic wounds. Why does this matter? Bioelectricity plays a vital role in cell signaling, migration, and tissue regeneration. When we restore or amplify this signal using EST, we can effectively wake up stalled wounds. Clinical benefits of EST include fibroblast and epithelial cell proliferation, critical for granulation and re-epithelialization, increased angiogenesis, new blood vessel growth, improves oxygen and nutrient delivery, enhanced leukocyte activity, bolstering the immune response to prevent infection, stimulated collagen synthesis, leading to stronger, more structured wound repair. When to use EST: stage 3 or 4 pressure injuries, diabetic foot ulcers, venous leg ulcers, surgical wounds not progressing, burns with delayed healing. This therapy is typically ordered by a physician or wound specialist, but nurses play a frontline role in setup, monitoring, and ensuring safe and effective use. As with any intervention, EST comes with contraindications. You must screen each patient carefully. Do not use EST if the patient has pacemakers or implantable defibrillators, malignant wounds or tumors, open wounds over the carotid sinus area, pregnancy, especially near the uterus, poorly drained or actively infected wounds. Now, your role as a nurse involves more than placing electrodes. Sterile technique is crucial. Contamination could delay healing or worsen infection. Apply conductive gel to ensure proper current flow. Ensure good electrode contact. Watch for slippage or dry patches. Monitor patient comfort. Tingling is normal, but pain is not. Observe for adverse reactions like redness, irritation, or bleeding. Document thoroughly wound size, exudate, tissue changes, and patient tolerance. Collaborate with physical therapy or wound care teams. Coordination enhances consistency in therapy. Electrical stimulation is a powerful adjunct therapy. It's not a magic wand, but when combined with solid wound bed preparation, good nutrition, and infection control, it can jumpstart stalled healing in incredible ways. Let's talk about a fascinating adjunctive therapy, hyperbaric oxygen therapy, or HBOT. In this treatment, patients breathe 100% oxygen inside a pressurized chamber, significantly increasing the oxygen concentration in the blood plasma. Why is that important in wound care? Well, oxygen is a critical player in collagen synthesis, fibroblast proliferation, angiogenesis, and bacterial defense, all necessary for wound healing, especially in hypoxic or ischemic wounds. Common indications include Wagner grade 3 or higher diabetic foot ulcers, radiation-induced soft tissue damage, necrotizing infections like Fournier's gangrene, compromised skin grafts, or flaps. HBOT is typically used when conventional therapies stall, or when wound hypoxia limits healing. It's a powerful tool when applied with proper assessment and timing. Of course, not all patients are eligible for HBOT. It's essential to screen thoroughly before beginning therapy. Absolute and relative contraindications include untreated pneumothorax, as pressure changes can worsen the condition. Medications such as bleomycin or disulfiram, which can react adversely under hyperbaric conditions. Severe claustrophobia, which may cause panic inside the chamber. Poorly controlled seizure disorders, since HBOT can lower the seizure threshold. Now, what's the nurse's role? Screen patients for contraindications and review medications. Educate them on what to expect. Monitor for signs of oxygen toxicity, such as nausea, twitching, or vision changes. Regularly assess for discomfort, like ear barotrauma, sinus pressure, or fatigue. Nurses are also critical in supporting emotional well-being, helping patients deal with confinement anxiety and setting realistic expectations. Now, let's step into the future. Smart dressings and biosensor technologies are revolutionizing wound care. These aren't your standard gauze pads. They are engineered with microelectronics or biosensors that interact with the wound environment, offering real-time feedback on healing conditions. Examples include pH-sensitive dressings that change color, signaling infection or healing stagnation. Hydrogels infused with smart materials that track exudate levels, temperature, or enzymatic activity. Wireless sensors embedded in the dressing that transmit data to a clinician's device, ideal for home-based or remote care. Benefits: early detection of issues like infection, delayed healing, or inflammation. More targeted and personalized care. Reduced need for in-person dressing changes in rural or home settings. Nursing role includes ensuring device calibration and functionality, educating patients on alert responses, matching the right dressing to the specific wound type. These smart tools are transforming nursing from reactive to proactive care. Next, we explore low-frequency ultrasound therapy, a non-invasive yet powerful tool in wound healing. This method uses sound waves in the 20 to 40 kilohertz range, delivered via a handheld device that helps debride wounds by breaking up slough and biofilm, stimulate immune cells like macrophages and neutrophils, accelerate tissue regeneration by improving perfusion and cell signaling. Indications include chronic venous leg ulcers, wounds where biofilm is suspected, patients sensitive to sharp debridement or who can't tolerate surgery. Avoid using it. Overactive bleeding sites, in deep infections or abscesses that are not yet drained. On exposed bone or implants, unless they are protected with appropriate barriers. Nursing considerations. Use with sterile saline as the conductive medium. Gently apply the handpiece in sweeping motions. Always wear PPE, as aerosolization of bacteria is possible. Low-frequency ultrasound offers both cleansing and stimulation, an excellent option for stagnant wounds. Let's finish with two cutting-edge technologies: cold plasma therapy and light-based therapy. Cold plasma uses ionized gas at low temperatures to create reactive oxygen and nitrogen species, which disrupt bacterial membranes, stimulate angiogenesis and fibroblast migration, modulate inflammation without harming surrounding healthy tissue. Light-based therapies like low-level laser therapy, LLLT, stimulate mitochondria to increase ATP production, supporting cell repair and reducing inflammation. These are particularly helpful in antibiotic-resistant wounds, burns or surgical incisions, wounds that are slow to reepithelialize. Nursing priorities include ensuring the correct wavelength and dose are selected, enforcing safety protocols, especially eye protection, explaining the science in simple terms to improve patient trust and compliance. These modalities may sound futuristic, but they are increasingly used in both specialized wound clinics and home care setups. Emerging wound care technologies are combining biology, engineering, and data science to personalize treatment like never before. Notable innovations include 3D printed scaffolds designed specifically to match the patient's wound contours, providing ideal structure for cellular growth. Nanofiber matrices that replicate the natural extracellular matrix and enhance cell migration and angiogenesis. Smart hydrogels embedded with sensors and drug reservoirs, able to detect infection and release antimicrobials on demand. Robotic systems that automate wound assessment, cleansing, or dressing changes, currently in clinical trial stages. Though still in development or limited use, these technologies promise tailored interventions that respond in real time to the wound's condition, ushering in a new era of precision medicine in wound care. Regardless of how advanced a wound care technology may be, the nurse remains the linchpin in ensuring safety, efficacy, and continuity of care. Key responsibilities include assessment, understand the wound type, healing stage, and suitability of technology. Use validated tools like PUSH or Bates-Jensen when applicable. Collaboration. Coordinate with physicians, wound care specialists, physiotherapists, and product vendors for proper application and calibration. Monitoring. Watch closely for adverse reactions, thermal injury from lasers, oxygen toxicity with HBOT, or allergic response to biosensor dressings. Documentation. Accurately record device settings, treatment duration, patient feedback, and any complications or deviations. Education. Train patients and families on using at-home devices, recognizing red flags, and adhering to protocols. The technology may evolve, but nursing vigilance, critical thinking, and patient advocacy remain constant. Empowering patients and caregivers is crucial to the success of any advanced wound therapy. Core educational points include: consistency is key. Emphasize completing the full course of treatments, even if the wound starts to look better. Know the warning signs. Teach what increased redness, foul odor, temperature rise, or drainage might indicate. Respect the device. Instruct them not to tamper with dressings, sensors, or wires unless advised. Support healing. Encourage high-protein diets, hydration, proper offloading, and stress reduction. Emergency protocols. Explain when to call the nurse or provider, especially in case of severe pain, dizziness, or device malfunction. Clear, empathetic communication can prevent complications, reduce fear, and improve compliance, ultimately leading to better healing outcomes. The adoption of these therapies isn't just about innovation. It's about results backed by science. Research shows electrical stimulation therapy shortens healing time in diabetic foot ulcers and pressure injuries by promoting cell migration and granulation. Hyperbaric oxygen therapy, HBOT, significantly improves outcomes in chronic radiation wounds and Wagner grade 3+ diabetic ulcers. Smart dressings reduce hospitalization rates by allowing early detection of complications, especially beneficial in home or rural settings. Low-frequency ultrasound enhances wound bed preparation, especially in chronic, non-healing wounds with biofilm presence. Light-based therapies increase mitochondrial ATP production and promote epithelialization, especially useful in burns and surgical wounds. These outcomes reflect better patient satisfaction, faster healing, and reduced overall cost of care. Advanced wound care technologies are more than tools. They're game changers in healing complex wounds that once seemed hopeless. As nurses, you are not just operators. You are educators, advocates, and the eyes and ears of the care team. Your role is vital in selecting appropriate technologies based on wound assessment, safely implementing and monitoring interventions, supporting and educating patients and their families, documenting progress to ensure accountability and quality. With proper training and teamwork, we can leverage these technologies to improve healing rates, reduce complications, and deliver care that is truly personalized and compassionate. Thank you for your dedication and for bringing healing to the bedside.